Hey there, my name is Brandy Gunnels and I'm doing my demonstration speech on how to insert an IV. And I'm going to show you my audience. There's Ruby and Norma. Okay, so this is my demonstration speech. I'm going to show y'all how to insert an IV. I'm a nurse here at Croy Health in Aiken. You can see I'm dressed in uniform. So an IV is primarily used for therapeutic purposes such as medication administration, fluids, or blood products. It's the most commonly used intravenous device in hospitalized patients. And it's usually done at bedside and it's performed with an aseptic technique, which just means to not contaminate with pathogens to the insertion site. So you must wash your hands, wash your hands, wash your hands. That's all you're going to hear in nursing school for your nursing students is wash your hands, wash your hands. So some of the things that you want to avoid with inserting catheter are you don't want to use areas of flexion, like if you have to bend your arm, you don't want to stick it right there in the middle of the arm. You want to avoid lower extremities because those will get ripped out as you move your feet, you get up and down. And any areas of skin that are already compromised. Anything that's bruised, swollen, or already painful. You want to try and stick with these areas on the arm. Okay. And some of the things that can happen with an IV are extravasation, which is infiltration of a drug or fluid into the surrounding tissue. Infiltration, which is the drug or fluid infiltrating into the surrounding tissue at the insertion site when the catheter tip either goes through or doesn't go all the way through into the vein once you put the needle in. And then of course there's phlebitis, which is very painful, can be very painful. And that comes from chemicals, movement, or some sort of infection at the IV site. Some of those symptoms are redness, heat, swelling, pain at or near the site. So that's all of that. The steps we're going to go over. So you want to gather your materials before you go into a patient room, which I have here is my little handy dandy IV kit. My flush, my extension tubing, and a catheter needle, an IV catheter needle. So you go into the room, knock on the door, introduce yourself. You wash your hands. If you were to be going ahead and giving IV fluids, or if you had an order to go ahead and give IV fluids, you would go ahead and prepare that. But we're not going to do that. We're just sticking to the IV insertion. So you want to prepare the patient. You want to look for any prominent veins, which means anything that's like sticking up. Just kind of feel around for a good vein, find a good one. Drop that back up. So once you found one that you think is going to be good, take all your supplies out. I like to go ahead and get my tape ready that I'm going to use. Stick it down on the table. Okay. I'm going to go ahead and open my catheter and then my extension tubing. I will go ahead and. So here's my flush. I'm going to make sure it flushes. Alright, so that flushes just fine. I'm going to leave that just like that. I'm going to go ahead and apply my tourniquet. Touch. Put on sterile gloves. Again, this is something that your nursing students will do 100 times before you get out of nursing school. Metal. And this one, you pick it up in the middle of the paper and you throw that in your trash can. Get your alcohol wipe, and whatever site that you're going to use, you're going to scrub around that area. So I'm going to use this vein here, and the way that I like to hold it is you want to kind of anchor the vein down that you want to use. Scrub around that site. Give it a few seconds, let it dry. Just gonna wipe it off. Remove the safety cap from the needle, and you want to make sure the bevel of the needle is up, like so. Okay. And you anchor your vein, and you just kind of do it in like a scooping method. Insert at a 45-degree angle. And once you get in, you want to advance your catheter, not your needle, because that's how you can cause some of those problems. And you want to hold that in place there. Discard that. Hook your extension tubing up to it. And then you want to make sure that it flushes fine. Make sure all the juice goes in. Once it flushes okay, then you can anchor it down. Oh, sugar. Some people don't like for them to dangle, so we tape it up. And there you have it. Those are all the steps, and those steps are provided from the Lippincott Procedures IV insertion site. Once again, my name is Brady Reynolds, and that was my demonstration speech. Thank you for listening to the end of my video. Thanks, guys, for listening.